Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah. Today we are talking about a very common virus known as influenza. Why influenza is more important than many other problems. The most important reason for to control influenza is it causes epidemics and pandemics, and every year they shift their genetic makeup and they can start causing problems. And every year's vaccination is not enough. So as he changes its genetic makeup, we have to change the vaccine accordingly. Next question is that how this virus spreads. So it is like many other bacterial and viral organisms which cause the runny nose, and it leaves the droplets in the air. And if the other person comes in contact, it can start growing there and cause a problem. So how it causes the infection, as I said, that there are droplet infections and it's taken up by the mouth and the with the nose, and it can go down all the way to the bronchi and even cause otitis media, especially in the children. So next question is that what is the signs and symptoms? In the beginning of the problem is like many other viral illnesses, and it can end up into a serious issue. Like it can lead to, after RSV, it can cause bronchiolitis, it can cause infection of the ear. So, like other viruses, it will cause many other issues. Like you will have congestion of the nose, you will have sore throat is hurting. It can cause cough. It can go all the way down and cause bronchitis. And sometimes it can go like sepsis or pneumonia, which can be very dangerous in immunocompromised patients. So signs and symptoms, it causes upper airway signs and symptoms. It can cause fatigue, it can cause fever, it can cause pain all over the body, and can make the person very weak, laying on the bed most of the time. It can cause cough and congestion, and it can cause the nasal blockage as well. So how can we prevent this infection? It's a very worldwide virus, so it's hard to restrict it. But what kind of protection we can use? We can wash our hands properly, and we had gone again and again into the problem, and that is through your hands and fecal oral route. The other way we can do is that we can wear mask all the time, so the contact chance are decrease much more. And then another thing is we can vaccinate the children, and if we vaccinate, the chances of getting it is lower. But the problem is that it shifts its genetic makeup and becomes active next year. So we have to make another vaccine, and we have to spread out, and we have to give to the masses. So treatment, we are very limited in terms of taking care of it. So prevention is better than cure. But what we can do, we can give a systemic care, like we can give antipyretics, we can give hydration for the patient, and we can give a good diet so that patient can fight this infection and it's taken care of. In immunocompromised patients, we may have to add up the antibiotics so that there's no super infections from bacteria. What kind of complications it can cause? As we said, it can cause problem with your upper respiratory tract infection, and it can get the super infection, but it can cause cough. And if moved down, it can cause bronchitis, even it can cause pneumonia, it can cause sepsis, and sometimes it can go travel to the central nervous system, causing encephalitis and meningitis. So very important concept is that this virus can play havoc among the communities, and most people who are vulnerable to it is very small children and elderly, immunocompromised patients, and having cancers, etc. That's the reason we try to vaccinate all the babies and young kids having immunocompromised problem, and very elderly patients, and people who have systemic infections like SLE and cancer. Yeah, the very important thing I want to talk about is that this virus is in two kinds, like influenza virus A and B. So A is responsible for all of the endemics and pandemics, and the other thing is that scientists and the doctor community is concerned that this patient can attack the body, and it can change its genetic makeup, and ultimately the failure to the treatment. So usually we give oseltamivir, and at the same time patients are having other kinds of problems, we give the different medication like in oseltamivir in RSV infection. So that's very much for now. Thank you. Allah Hafiz.